Hello, my name is Dr. Dewan S. Raja. Today I will discuss about multiple choice questions in neurology. This is our fourth set of questions. Let's start. Number 1. A 40-year-old otherwise healthy male presents to the emergency room with a severe headache that began suddenly while he was at work. He described it as a thunderclap headache. There is no associated fever, neck stiffness, or neurological deficits. CT scan of the head is unremarkable. Which of the following is the most appropriate next step in the management of this patient? A. Discharge home with analgesia. B. Admit for observation and serial neurological exams. C. Perform lumbar puncture. D. Order magnetic resonance imaging MRI of the brain. E. Complete blood count. So, what is the appropriate next step in the management of this patient? Patient is describing a thunderclap headache. Okay, CT scan of the head is unremarkable at this time. So, what would be the answer? Answer should be to perform lumbar puncture. C is the answer. C is the answer. Lumbar puncture is the lab test for the thunderclap headache. Question number 2. A 45-year-old female presents to the emergency room with a sudden onset of severe headache described as the worst headache of her life. She reports nausea, vomiting, and neck stiffness. On examination, her vital signs are within normal limits, but there is no photophobia and positive Brudzinski sign. Okay, so no photophobia and positive Brudzinski sign. Which of the following is the most likely diagnosis? So, typical presentation, worst headache in one's lifetime. Well, this is the example of subarachnoid hemorrhage, but we have to remember that sometimes it may not be the worst headache of one's life, but still it may be a subarachnoid hemorrhage. So we have multiple choice: migraine headache, cluster headache, temporal arteritis, tension headache. Our answer should be subarachnoid hemorrhage. E is the answer. Question number 3. A 60-year-old male presents with a sudden onset, severe headache and neurological deficits. The CT scan reveals blood in the lateral sulcus. Okay. In the basal cistern. Imaging confirms a subarachnoid hemorrhage due to ruptured berry aneurysm. Berry aneurysm, common site is circle of Willis or around it. The patient is hemodynamically stable. What is the most appropriate next step in management? A. Immediate endovascular coiling of the aneurysm. B. Emergent craniotomy for surgical clipping of the aneurysm. C. Discharge home with instruction for outpatient follow-up. D. Transfer to intensive care unit for close monitoring. E. Initiate broad spectrum antibiotic. So our answer should be here. Answer should be transferred to the intensive care unit for close monitoring. This is the most appropriate next step. Okay, let's go to the question number 4. A 26-year-old female presents to the emergency room with a sudden onset of severe generalized headache, confusion, high fever, nausea and vomiting. Upon examination, she has nuchal rigidity, stiff neck, photophobia, and positive Karnick's and Brzezinski signs. Which of the following is the most likely diagnosis? Okay, so we got stiffness of the neck, we got photophobia, positive Karnick's sign, positive Brzezinski sign. So out of these, what would be our answer? Our choices are encephalitis, B meningitis, C stroke, D brain tumor, E brain abscess. Our answer should be what? Okay, answer should be Karnick's sign positive, Brzezinski sign positive, neck rigidity. Answer should be meningitis. B is the answer. Meningitis. B is the answer. Okay. Now we'll go to the last question in this section. A 31-year-old woman who is HIV positive presents with a history of headache, fever and altered mental status for the past week. She has multiple cares in her home. On examination, she is disoriented and has focal neurological deficits. An MRI of the brain shows multiple ring-enhancing lesions like this ring-enhancing lesions. What is the most likely diagnosis? A. Toxoplasmosis encephalitis. B. Cryptococcal meningitis. C. Tuberculous meningitis. D. Metastatic brain tumor. E. Lymphomas in the brain. So, MRI shows multiple ring-enhancing lesions, and she has low body immunity. She is HIV positive. Despite that, she has multiple cats in her home. So what would be our diagnosis? These are the choices. Our diagnosis should be toxoplasmosis encephalitis. That is, A is the answer. So these are the answers. So that's all for today. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.